going to share my screen. My name is Cathy Cather, and I am the CEO and co-founder of Parallel Profile. And I'm going to get this into slideshow. Everyone is talking about treating and curing these diseases. And in fact, a lot of people are already, but not everyone is, and more can be because of our program. The problem is we're not all the same. Genetics make people respond differently to drug, and 97% of us have a genetic variant that impacts both the safety and the effectiveness of a drug. As a result, people die unnecessarily, and billions are spent every year. And 90% of drugs aren't working for the people taking them 30% of the time. That's true in diabetes, it's true in cancer, it's true in all of these diseases. Genetics also are responsible for a lot of the racial inequity in healthcare delivery, because different people of different genetic backgrounds respond differently to treatment. Currently, 43% of people taking drugs in the US are taking something that's not going to work optimally for them. So what we do is we give them an app where once they've had their genetic test, which is simple swab, they then can put in the first 3 letters of any over-the-counter or prescription drug and instantly know whether or not it's going to be safe to take with the other things they're taking, whether or not it's going to be effective for them if there's a known gene impact that's relevant to them, and also whether or not it's going to be affordable because it's tied into their plan. Now, the market is huge. Over 170 million Americans are currently taking 2 or more drugs, and 155 million of those people are working for an employer who pays their medical bills. And employers love us. In fact, last year we were named one of the 10 top most innovative healthcare companies in the US by these employers on the screen. And their reasons for wanting Parallel Profile are obvious. Again, it's very easy. We have specially trained doctors available through a network online. People swab it, send it back, and then they have the results with them in their pocket all the time. We've already accomplished all the development and research, working closely with these employers to make sure we were developing what they wanted. We had the MVP, had a lot of them test it, learned some more. And so now we're in preparation for pilots with those employees and making sure that we have the infrastructure for integrating with all of their other vendors, because it's important that anyone on their benefit team or any of their vendors, when they talk to a patient, they remind them to use the Parallel Profile. We're the only ones that do it this way. There's others that have lab reports, but it's just a snapshot. If a week or a month later they have cancer, they don't have the information they need. So it's constantly updated. They can put in the name of any new drug they're being considering, and it'll give them the answers. We have a team of people very committed to this, very competent with amazing backgrounds, and the revenue projections are considerable. Right now, we're looking for 2.5 in investment to complete the multi-tenant platform for all these employers and all their vendors. And I hope that you'll join us, because the employers are ready and waiting and asking me every day when they can have the platform.
Awesome. Thank you, Cathy. That was great. A few questions that I have received. Congratulations on the Employer Health Innovation Roundtable Award.
Thank you.
A lot of labs can do similar tests. Why do you think that Parallel Profile received that award?
Because we understand employers, we understand the environment, we understand that they have co-pays in their benefit plan. And we've agreed to integrate with all of the other vendor programs that could interfere with the adoption, making sure that it's going to be covered, that the employer will pay for it for the employee so that there's not a concern about that, as well as when someone is going to have, let's say they're going to have a surgery, in addition to asking them what surgery they're going to have, they'll now be asked that doctor will be asked, what medications are you projecting to use? And they're going to use anesthesia and antibiotics and pain meds. And all of those could become a problem. And that's why now they'll be checked in advance before they're administered. Nobody else does.
It makes so much sense. Yeah. Question in the chat from Anne DeGeest. Why is this better than 23andMe?
Well, first of all, if you get a 23andMe report that has some pharmacogenetic information on it, it says in the disclaimer, do not rely on this report. Do not make decisions about medications based on this. Do a repeat full genetic pharmacogenetic test. So we love it because anyone who gets it and is alerted of a problem then is directed to people like us to do it over and make sure that in fact meets all the FDA requirements, which they don't.
Thank you. Tell us a little bit about the impact of the pandemic on your business. Virtual care and e-prescribing has just skyrocketed. How did that shift impact adverse drug interactions and your work by extension of that?
Well, I think the most important thing is that people trust and are comfortable with telemedicine now. And that's really helpful because there are in the moment situations when you can get in touch with somebody who understands what we do. And so they can, and they do, and they've got the immediate access to do that. Whereas before they may not have felt comfortable doing that. So that's important. I think also people are a little bit more concerned about adverse reactions. And so anyone who's had an adverse reaction, and since 2.7 million people had an adverse reaction every year for the last 12 years, that's 30 million people. A lot of people know somebody who's taken a drug and had a bad reaction to it. And so this just made them a little more aware that maybe they should be careful too.
That's great, Cathy. A couple other great questions. We can hopefully squeeze in one or two more from the chat. How many actual patients have used the platform already and were able to find a better treatment plan? What is the impact?
Well, we're pretty new. We've only done the MVP test with a couple hundred users, but our lab has done 120,000 tests. So we know that 43% of the people are going to be currently taking one. We also learned that people are using it because they call and thank us a lot and they message us. And those, we had a person who had cancer, found out that her chemo was going to work for her, even though it doesn't work for over half the people, and was thrilled, called us to thank us. A few weeks later, she called us back and said, you just really saved my life again, because I was going to buy something for my acid reflux, which my nurse practitioner told me to go to the store and get, but because it was a drug, I put it in the app and your warning popped up and said, warning, this makes your chemo less effective. And she said, I would have taken that. So we know because people tell us, but that's what the pilots are for, because these employers want to make sure that not only do people have this available, but they use it. And we've got all kinds of strategies set up with those employers to make sure they do.
Mm-hmm. Yeah, I've always thought something like this should be available just in your profile when you're ordering meds on CVS or what have you.
Well, the top
ubiquitous.
Yeah, the top system that doctors and hospitals use that are in all the pharmacies has already agreed to integrate with us. So it will be. If you have a parallel program, it'll be on your medical record.
That is awesome. Time for one more question from Ryan Kelly. Great presentation. How does your test address and meet evolving FDA requirements around direct-to-consumer pharmacogenomics testing? Well,
what we do is we do it through the health plan and ordered through a physician, so it's not direct to consumer. It's like any other lab test that your health plan covers.